Today I'm going to talk about faces. What is faces? What is faces? Face is an expression of face in a patient. When you are going to study the patient face, that expression which will give expression of face is known as faces. What is this face is looking like? It is an anxious faces. Anxious faces is the faces which indicate the awareness or apprehension of the patient about the disease. It is commonly also seen in nervous people, nervous individual. This is giving a dull and vacant look. It is mostly seen with mongoloid features. What is the characteristic of this faces? There will be slanting eyes and epicanthic fold, small pinching nose, and small oral cavity. It is commonly seen in cases suffering of Down syndrome. Trisomy. What is the trisomy? Trisomy 21. Now, this is a faces which is devoid of any expression, devoid of all expression. This one is having a vacant look. This one is a devoid of expression. This faces is known as masked faces. Where do you see masked faces? In Parkinsonian syndrome. Parkinsonian syndrome. What is the feature of marked faces? Look at the eye. It is having an infrequent blinking, and there is lacking ocular movement. Is less. Apart from this, the palpable features are white. Now, this is seen in Parkinsonian syndrome, but also seen in some other myopathies like facial myopathies. It can also be seen in cases of bilateral facial edema, paralysis, progressive systemic sclerosis, but most commonly it is seen in Parkinsonian syndrome. So this is about marked faces. Now come to this. What is this? This is a feature of hepatic faces. Hepatic faces. Eyes will be shrunken. The temporal side of the face will be hollow. The lip is parched. Nose is pinched. Complexion will be muddy. And there will be icterous tinge. That is a feature of jaundice of the conjunctiva and the skin. So this is about hepatic faces. These faces I will cover in 2 different videos. So I will request my viewer to please go to the second part also. Now coming to one important feature known as pallor. When we see the face, we can see there is pallor on the face. What is pallor? Pallor is a condition when the capillary circulation is the blood circulation is diminished, right? Blood circulation or capillary circulation is less. So it can be of many type, means 2 type mainly. Circular circulation is less. So it can be 2 type. It can be with anemia, it can be without anemia. Now if it is with anemia, means it will with anemia. So what are the causes? Obviously there will be anemia itself, severe anemia, and any condition which causes defect in circulation like infective endocarditis, when there is infection, acute rheumatic fever. This will have with anemia features. Coming back to no anemia, pallor with no anemia. So this is mostly related to cardiovascular causes. So what is it? This is our heart, aorta. So there may be problem with the left side of the heart. There may be tight. Let me take a different color for this. There will be tight mitral stenosis, very tight mitral stenosis, and severe aortic stenosis, acute myocardial infarction. There may be acute left ventricular failure and acute myocardial infarctions. Yeah, MI can be there. Yes, this is all about heart causes. Apart from this, there will be acute circulatory failure. If this is stenosis is there, there will be acute circulatory failure. This is also related to heart. Apart from CV cause, there may be other causes. The other causes are again nephrotic syndrome, CV cause or other nephrotic syndrome. In nephrotic syndrome, there will be pallor without anemia, and there will be causalgia. It can be due to acute nephrotic and nephritic. Both are the causes of pallor without anemia. So this is all about